Access to essential health care in Gaza is precarious and the situation is horrific. Those words coming from the World Health Organization, who adds that this month, Israel has banned 6 partner medical organizations from entering the Strip to provide much needed care to 3 hospitals. Our next guest is a GTA ER doctor who volunteered in Gaza for nearly 1 month in September. We welcome Dr. Salman Khalid here to City News. Thank you so much for joining us today. We really appreciate it. I just want to talk a little bit about you just got back a few weeks ago from Gaza. I want to talk a little bit about what you were doing there and what you saw.
So my role, thank you for having me first off. My role was part of a 3-member team from an organization, Humanity Auxilium, serving a hospital in central Gaza, the Al-Aqsa Hospital in central Gaza in Deir al-Balah. My role primarily was as a trauma and resuscitation physician. I spent pretty much every day there in the resuscitation room, treating mass casualties and other critically injured patients, both adults and children.
And we're seeing the team of doctors you were working with and some of the images, including this one here. The patient you are taking care of is on the ground. Can you talk a little bit about the condition and the conditions you were working in?
So the best way that I can describe the conditions at the hospital that I worked at would just be best described as chaos. When a mass casualty rolls in, there's no beds in the hospital. The hospital is wildly over capacity. So when the patients arrive, they're essentially just dropped on the floor of the resuscitation room. So all of your resuscitative efforts take place on the floor, which makes things incredibly difficult. There's a paucity of medical supplies, including chest tubes, breathing tube equipment, even scalpels to insert chest tubes into patients. So we're working in an extremely resource-limited setting when treating these patients.
We're seeing these images here coming out of Gaza, the noise of the ambulance. You talked to me a little bit about the noises you're hearing as you're going to work. Can we revisit that a little bit?
Sure. So essentially, what I've described to my colleagues and friends and family is that my background noise while working in the emergency department there was mostly screaming kids. I was taken aback by the sheer volume of children that were suffered the mass casualties and the trauma. And oftentimes these kids were on the floor of the ER, including the waiting room and resuscitation rooms, just mostly screaming in pain, screaming for their parents. Pain medications are in limited supply, so we had to sort of ration who we could give pain medications to. And there's obviously, it's just complete chaos there when it happens.
And as you're making your way into ahead of that, we've been hearing about how it's been such a challenge to get aid into Gaza, to get humanitarian aid and help into Gaza here. You went down with medical equipment yourself. Were you able to take that in there?
No. The COGAT, which is the administrative arm of the Israeli military, limits and has severe restrictions on what medical equipment healthcare providers can take in. So I had some ultrasound equipment and some other equipment that I had to leave in Jordan. I was not allowed to take it in. Since the Rafah border was closed on May 6th, it's completely hampered the ability to take necessary medical supplies in. It has to be shipped through cargo, which sometimes takes months if it does get in.
What does that mean for the care for patients in Gaza?
Well, it suffers because oftentimes it feels like you're practicing with both hands tied behind your back. There's no, even something basic as sterile gauze, sterile drapes for the operating room. Scalpels don't even have handles, so when you're cutting patients, you're using a small little blade. It looks like a shaving blade. There's no concept of sterility. For example, patients at our hospital that had a burn of a greater than 30% total body surface area, which would be a very treatable burn in North America, were deemed what's called a hopeless case, meaning that there was no likelihood that they would survive because of a paucity of sterile gauze to keep their wounds from getting infected or antibiotics. So it's, like I said, it's extremely resource limited.
So hearing you speak about your experiences there, I just want to revisit the latest coming from the World Health Organization and reports of the banning of at least 6 partner organizations. So the WHO says that it's concerned about the impacts this will have on already in a week they've seen 1/3 reduction in trauma care and a 25% decline in surgeries. They're also highlighting that this is a collapsed healthcare system. I'm wondering from your end, as somebody who did go to Gaza to provide medical care and help, what your concerns are about this development.
So Over the past year, almost half of the over 30 hospitals in Gaza have been either destroyed or rendered unusable. Over 1,000 healthcare workers have been killed. The situation is untenable for the patients that are in Palestine and Gaza right now. By restricting humanitarian aid and medical teams from entering Gaza, it's going to further limit access that these patients need access to, and will likely result in the increased loss of human life and of the Palestinians in Gaza.
Okay, we have heard those concerns coming from the World Health Organization as well. Our thanks to Dr. Salman Khalid for coming here today. We thank you.
Thank you.